going to stay away from national news today. It's been kind of a busy couple of weeks, actually, maybe 3 weeks all in. Uh, Lots going on. So we'll just sort of leave it at that. But there are a few things that are happening in the dental world as well that I think are absolutely worth mentioning. The first story might be one of my favorite stories that I've seen in a long time. There's a dentist suing a patient over a bad review. I love this. I think so many dentists would feel so vindicated if they could go after a patient who leaves maybe a stretched version of the truth of what happened in the office. So there's a Minnesota doctor who has now filed charges against a patient who is leaving negative reviews for his practice. The patient came into his clinic, had a couple things done in fillings, crowns. Outcome wasn't what I believe she was hoping for, had some issues, went to another doctor who said some of the work needed to be redone. Okay, fine. This story has played out 1,000 times before. But then the doctor's office, according to the court documents, had offered to have her come back in to see if they could help. They've even offered her financial payment for the services that she had rendered, reimbursing back her insurance company as well. She wanted to increase that amount. When that wasn't met, and these are all the court documents, when that wasn't met, she then went forward with some additional negative reviews and then kept editing the negative reviews when the doctor filed legal charges against her. So I'm just saying, it's actually nice to see for the first time, maybe that at least I'm aware of, that a doctor is standing up to the review system and saying, look, we get it. If you want to voice your opinion about whether or not you like the fact that we take x-rays, totally fine to go on Google and Yelp and let people know about that. But when you use those platforms to spread misinformation, incorrect information, or to just defame somebody who's running a small business just trying to, bring home money to take care of his wife and kids, then enough already. Like your point is a little bit done. And now we're going to see it play out in court. I think it's really important that that will then set a precedent. Fingers crossed that this will go in the favor of the dentist, just because I think we need it to be able to set some type of standard for how dentists and patients can interact with one another through the review system. We're really have been told for a long time to keep it tight, not respond because of HIPAA violations. And there have been a couple of doctors who've been cited for HIPAA violations in the past for at least acknowledging that that patient was a patient of their practice. So it'll be nice to start getting some type of, benchmark or metric that we can operate by and how we manage these reviews moving forward. Because frankly, it's getting a little old for dentists to be held somehow hostage to the court of public opinion. The next interesting story that came out is we talked about this about a year ago. There was a lot of activity in the FTC about non-compete, and they were going to go after the non-compete stance. They were going to, change the language on the non-competes and actually kind of open up non-competitive language. Well, the FTC has now said it will not fight a lower court's decision to throw out that rule. The FTC voted 3-1 on that on September 5th to dismiss the appeals in the lower court. So I guess we're going to see that kind of fade off into the sunset again. We'll see if it rises back up to the top at some point. We do believe that it opens up the door for additional conversation about non-compete, and certainly state by state, some states are going to enforce it a lot tighter than others. So just know your language well. But if you've been operating under that old piece of news that we ran with a year ago about FTC not really recognizing non-compete agreements anymore, that is factually not true. Your non-compete will stand if you have signed one. So make sure you know the language really well, and ultimately how your state is siding for or against those non-competes. And with that, that's the news.